Good afternoon. Thank you for joining our webinar on Making Connections in the OR. I'm Gail Davis. I'm Director of Corporate Communications for AORN. We've invited both marketers and manufacturers reps to attend because we believe a better understanding of the nurse's point of view will make all of you more effective in developing your sales and marketing strategies and approaches. We can promise you that the ideas and suggestions you'll hear come from experience. We are the largest association of perioperative registered nurses in the world, nurses who count on AORN for education, training, and professional development support that they need to be successful. It's because we also teach nurses how to work with reps and make product decisions. We decided it's time to help further strengthen your relationships by teaching reps how you can, in turn, best work with decision makers. So let's meet our presenters. Dr. AORN Kyle is Editor-in-Chief, Guidelines for Perioperative Practice. She was the lead author of the 2019 AORN Guideline for Sterilization and the 2020 Guideline for Sterilization Packaging Systems. Prior to coming to AORN, Dr. Kyle worked as a Regional Director of Perioperative Services for a large health system in the Midwest. In that role, she was responsible for enterprise-wide surgical supply optimization, working closely with both vendors and clinicians to identify value in surgical supplies. Dr. Lisa Spruce is AORN's Director of Evidence-Based Practice. She's responsible for the overall leadership, development, evaluation, and maintenance of our products, services, and guidelines for perioperative practice that are developed by AORN's Nursing Practice Team and AORN's Research and Information Center. In her life before AORN, Dr. Spruce was the Clinical Manager of Surgical Services for Universal Health Services, where she managed all clinical practices for 25 perioperative departments throughout the U.S. Our third speaker is Dr. Julie Kahn, a perioperative practice specialist for AORN. She was the lead author of the 2019 AORN Guideline for Sterile Technique and the 2020 Guideline for Autologous Tissue Management. She's currently revising the Guideline for Specimen Management. Prior to coming to AORN, she worked in 8 different perioperative departments throughout the country in multiple surgical specialties and roles. In addition to our 3 presenters, in the room we have James Sondrup. He's an account exec with AORN's industry group. Not too long ago, James was a rep himself, and he'll be joining the Q&A at the end of the webinar. Let's start with Dr. Kyle, who'll begin with the language and expectations of nurse decision makers.
Thank you, Gail, and thank you all for joining us today. Before joining AORN, I worked as a perioperative nurse and leader in various roles. I've been a circulating RN, a board runner, a clinical supervisor, assistant director, director, and regional director of perioperative services. So in each of those roles, I interacted with reps and learned from all of those experiences just what an effective rep looks like, sounds like, and acts like. One thing I observed over the years is that courteous, open, honest, and intentional communication leads to success for both reps and clinicians, and this results in optimal patient outcomes. It may surprise you to know that perioperative nurses across the country turn to AORN to help them with their product selection decision-making. We estimate that there are 160,000 practicing perioperative nurses who are, in every surgery, relying on AORN recommendations for their decision-making. They count on AORN's guidelines because to become known as a high-quality facility, nurse decision-makers need to be careful to make purchasing decisions that improve outcomes and increase patient satisfaction. Whether they are for-profit or not-for-profit facilities or ambulatory centers, their goal is to identify opportunities to purchase products that will reduce cost and grow their bottom line while providing safe patient care. In other words, they are looking for value. Let's take a look at 4 key steps to assist you with the perioperative RN steps in evaluating and choosing products. First, we recommend you complete due diligence. Before a potential new product receives serious consideration, nurses study all options. If it is a new clinical item, such as an implant, they'll check to see if the FDA has cleared it and how long it has been in use. They might also look for stories, both good and bad, about the product and if there are any reviews available. If you know that there is anything negative in your product's past, come prepared with that data, those facts and examples about how you rectified that situation. From a financial perspective, they'll research whether the product is on contract with their organization and whether or not they can bill for it. In today's healthcare world, it is extraordinarily difficult to purchase products that are not on contract with the facility, and some health systems have enterprise contracts that each facility is also bound to. For this reason, it is essential that you first know whether or not your company has a purchasing contract for the item, and if not, find out how contracting decisions are made. Each organization is different, and sometimes the decision is handled by a committee that includes purchasing professionals, administrators, and clinicians. When you know this process, you are better suited to offer information that supports the decision-making process. You should get this information into the hands of the perioperative RN that participates in this decision process. Another key due diligence task is to know the facility's vendor check-in process. Are you in the system? Be sure you can check in advance of arriving to the facility. Arriving to your meeting having checked in will set you up for a great first impression. All of this should be done before you request a meeting with the perioperative RN decision maker. If the due diligence process does not raise any red flags, the team will analyze the value a new product brings to the facility. They typically will not add a new product simply because a provider asks for it or a vendor says that they should. The nurse leader will bring together an interdisciplinary team, including materials management, to carefully review any products they are considering investing in. The perioperative RN decision maker is likely the person who will assemble this interdisciplinary team. They'll discuss how the product will impact patient care and analyze the costs to their facility and to the patient. If applicable, they'll compare that product to what is already in use. The key components of product evaluation will include considerations for compliance with local, state, and regulatory requirements, clinical usability and cost effectiveness, patient and user safety, improved patient outcomes, product quality, strategic priorities of the facility or organization, vendor contractual agreements, which we've discussed, compliance with accrediting organizations, compatibility with existing sterile processing methods, compatibility with existing disposal methods, patient population needs, and personnel and end-user preferences. As a rep or marketer, how can you prepare clinicians to evaluate your product? Take a hard look at your leave-behind materials. Are they sufficient to tell the story when you're not in the room? Whenever possible, your customer will trial a product extensively. For example, an ambulatory surgery center we know sent their team to a conference last year to learn about ice packs designed to mold to a patient's body. This was in contrast to what they were using, which were more rigid in design. They asked the company that designed the moldable ice packs if they could trial them. They brought some back to their ASC and used them on patients, requesting their feedback. A teammate also had a neighbor who had undergone hip surgery, and she brought one home to him to compare to the more rigid packs that he was provided. What we learned from their patients and this neighbor was that the ice packs not only fit better, but they stayed cold and in place longer. While these newer ice packs were an improvement over the type used by the ASC, there was one concern: they would not be billable until the next year, which was 2020. Had this been a more expensive product, they may have postponed the ice pack purchase. But since they felt that the ice packs provided an improvement in care at minimal cost, they leaned toward making the switch anyway. What sealed the deal was when the company that developed the ice packs offered to imprint the surgery center's logo on the packs for free if they partnered with them in 2019. Now they have a great product that is also a great marketing mechanism. Using this example, I would invite you to ask yourself each time you do a trial, what can you do to help make this buying decision easier for the perioperative team? Number 4, follow-up. Maintaining great relationships after you have made a sale can benefit your company and your healthcare customer in some important ways. Following up with an organization after making a sale tells your customer that you care about their success and satisfaction with your product. When you initiate follow-up with your customer, you'll hear about any issues they could be having before it becomes a big problem. What you don't want is for the customer to have to track you down, especially if you could have helped when the issue was discovered before it's grown into a big problem. Another benefit of your initiating follow-up is that it clearly shows that you and your company have a commitment to the perioperative team's success. A customer who feels supported after a sale will likely buy again from someone who is on top of the relationship. For follow-up to be effective, it should be done properly by being timely. And how do you know what is good timing for your customer? Ask the nurse leader that you worked with to set up the trial. So ask them this question: when would you like me to check in with you about how your team is doing with my product? Another way is to be available to troubleshoot when you do the follow-up. In other words, plan ahead to have time to visit the facility during this follow-up period if needed. And another thing, checking in more than once may be needed. Every team that you work with will have different needs and will need more or less support and follow-up depending on their needs. In other words, your experience selling your product in one facility may be much different in another facility, even if the product is the same. You want your relationships to last, and follow-up is essential for that. Now I'll turn this over to Dr. Spruce.
Thanks, Erin. Thanks, everybody. It's wonderful for you to be here with us today. Like Gail said, I was a clinical manager for multiple hospitals, and we had an interdisciplinary committee who evaluated the products that we were considering buying for our facilities. It was very important that the industry reps had given us the best information possible and presented their products in a clear and concise way. So that is why we are now going to talk about how to effectively present the products. Let's start with what you should know about a facility before you walk in the door. What do you need to know to be prepared? Well, first of all, you need to know those facility policies. Those policies and procedures will be available from facility managers or directors, and you should definitely familiarize yourself with these policies. I know a rep who came into a facility proudly, happily carrying donuts and bagels for the staff, thinking, wow, this is going to be a great introduction. But in reality, the facility had a strict policy on reps bringing in food for the staff. So make sure that doesn't happen to you and that you read those policies before you go in. And yes, it's important to demonstrate how your product supports ROI, but nurses, they really also want to know how it's going to help support better patient outcomes. And your certification is also very important. You are a member of the healthcare team, and perioperative nurses want to be sure that all members of the healthcare team have undergone training and credentialing to be granted the right to participate in a patient's care. Providing all the necessary components for certification reassures hospital leaders the industry rep has the competence and knowledge to be part of a safe, ethical, and competent healthcare team, and this will be reflected in their policies. We also want great nurse-rep collaboration because during evaluation of new products, perioperative decision makers will want to know how you will help provide training to those who are going to be using your device. So think about it. Will you provide education and hands-on training? Personnel sometimes work off hours, so how will training of these people be covered? Be prepared to answer these questions as you review your product's attributes. Keep in mind that training may also include other departments such as biomedical engineering, materials management, and sterile processing. An important distinction to make is that education of personnel on devices should come from the device manufacturers. The education on role and practice of perioperative personnel should come from the facility. When you work as a partner with perioperative leadership, you can help ensure that questions that come up are answered by the right person, be it the manufacturer or the facility. And you want to build lasting relationships. Nurses are looking for reps who are engaged, who care about patients and the work the nurses are doing. Nurses depend on a collaborative relationship that's long-lasting, and they want to know their reps well enough to feel comfortable to reach out to them for practice support. It is beneficial for reps to establish ongoing meetings with nurses to get to know what their needs are in implementation and also in patient care. You should remember that you are a guest, and reps should come to those meetings well prepared, knowing AORN's guidelines and knowing what help nurses need. I had a great connection with one of my reps. This rep had trained us on a new piece of equipment that was really rather difficult to learn, and even after the training, she was available when I called her, just helped me to troubleshoot, answered questions whenever I needed, and she also came back when we needed some more hand-holding, and I was very grateful for that relationship, and it ended up to be a long-lasting one. So AORN's guidelines, let's just talk a little bit about them. They are our authoritative resource for evidence-based recommendations that, when implemented, guide the delivery of safe patient care and help achieve workplace safety. They are developed with AORN's nurse authors with input from industry and in collaboration with professional societies, including the American College of Surgeons, the American Society of Anesthesiologists, APIC, and ISHM. And we follow the National Academies of Medicine standards for developing trustworthy guidelines. And they're so important. For the nurses, the most important benefit of clinical practice guidelines is their potential to improve both the quality and process of care. AORN guidelines guide perioperative nurses in giving the highest, most effective care to patients based on the latest available evidence. And AORN guidelines are important to industry because not only can guideline recommendations impact products and purchasing decisions, industry reps can assist nurses implement AORN recommendations in practice that will ultimately improve patient outcomes. An example of this is AORN's recommendation that patients are kept warm during surgery. And as a result, industry has provided patient warming devices to help nurses implement the recommendation, and that leads to a decrease in a patient's risk of developing a surgical site infection. If you can speak to the guidelines, then you're speaking the language of perioperative nurses. Now, when you align your products to guidelines, nurses listen. Know what you need from AORN's 33 guidelines for perioperative practice to help sell your products. When nurse decision makers evaluate a product, they compare it against how well it aligns with AORN guidelines. Industry reps who are knowledgeable about the AORN guidelines are positioned to understand the needs of perioperative purchasing decision makers. Even better, when you follow updates to AORN guidelines, which are published throughout the year, you are positioned to anticipate the needs of those perioperative purchasing decision makers. AORN's guideline resources come in many formats that are often updated throughout the year. So knowing where and how to search for guideline information is key for industry partners. AORN's Facility Reference Center is a great place to start because this is the location where guideline updates published electronically can be accessed during the year ahead of that print publication, which is only released at the beginning of the following year. The Facility Reference Center is also searchable, so if you're trying to capture every guideline and individual recommendation relevant to your product, you can apply your specific search terms. For example, a smoke evacuator will align primarily with the guideline for surgical smoke safety, But an endoscope drying cabinet may align with recommendations in the guideline for flexible endoscopes and the guideline for high-level disinfection. And a wonderful resource for you is the Guideline for Medical Device and Product Evaluation. It can help industry reps anticipate the who, how, and why in the perioperative procurement process. From the perspective of the perioperative nurse, products that are designed around the guideline recommendations are the best products. Relevant guidelines can often overlap, so it's valuable to be thinking about multiple guidelines that relate to your product and be able to speak to them when meeting with perioperative teams. For example, in the newly updated guideline for sterilization packaging systems, AORN recommends that when tip protectors for sharp instruments are used during sterilization, those tip protectors should be colored or tinted because clear and colorless ones can result in a greater risk for retained surgical items. This ties in with two other guidelines, the Guideline for the Prevention of Retained Surgical Items and the Guideline for Sharp Safety. Using this example, you can see how the guidelines work together, and they are all important to understand whether you are a perioperative RN or an industry partner. AORN currently publishes 33 guidelines for perioperative practice. So rather than giving you that entire list, it's too long, I've pulled two guidelines to provide examples of how you can demonstrate your understanding of perioperative practice and nurses' expectations when you connect your product or device to the guideline. Let's start with a look at AORN's Environmental Cleaning Guideline, which provides guidance on the selection and use of cleaning products, cleaning procedures, personnel education and competency verification, and monitoring cleanliness through performance improvement processes. Products that relate to this category include disinfectants, cleaning chemicals, cleaning materials and supplies such as mops and cloths, personal protective equipment, containers for medical waste and room decontamination systems such as ultraviolet light and hydrogen peroxide. And another example is AORN's Guideline for Sterile Technique. In this guideline, we provide guidance on the principles and processes of sterile technique, which involves the use of specific actions and activities to maintain sterility and prevent contamination of the sterile field and sterile items during operative and other invasive procedures. Products that relate to this category include sterile gowns and gloves, masks, sterile drapes, sterile supplies, and wound protectors. Now remember, there can be overlap. For example, masks, gowns, gloves, and attire are all addressed in several guidelines. They're addressed in sterile technique, environmental cleaning, surgical attire, and transmission-based precautions. So I have given you a couple of guidelines as examples, but I encourage you to go through the titles of the guidelines and you will be able to see where your product fits. So thank you, and now I'm going to turn this over to Dr. Julie Kahn, and she's going to talk about the do's and don'ts of top-notch service.
Hello. One of the things I love about working with manufacturers' representatives is your in-depth knowledge of devices and products. I once worked with a wonderful representative from a large suture manufacturer. We worked together to provide education on suture to new perioperative nurses. She would provide the manufacturer-specific instructions for use on the varying types of suture that we carried at our facility, and then I would provide the information and education on accountability, counting items to prevent retained surgical items, and sharp safety. Today, I'm privileged to go over those do's and don'ts of top-notch service with you. So start off on the right foot. Do your homework before you enter the building. This helps ensure that you are ready for decision makers and organizational preferences and needs. One of the steps that's essential in your pre-work is to confirm if the healthcare organization requires vendors to be registered to enter the facility. Registration helps comply with regulatory and facility requirements. Now, if it's required, make sure you are registered. To register, you may need vaccination information and safety training ahead of time. You don't want to find out that you need to be registered when you're ready to bring your product into the building the first time. To make a strong connection, be prepared to answer the following questions. How does your product ensure patient safety and support optimal patient outcomes? How does your product compare favorably to a similar product already in use? Can you answer how your product saves time during patient care delivery? How does the cost of your product relate back to achieving improvements in patient care, efficiency, and the healthcare worker experience? As Lisa was saying, evidence is key in perioperative purchasing decisions. So be sure to bring white papers or even better, published data from a peer-reviewed journal to illustrate how your product achieves these improvements. Now, arriving early is a sign of respect. However, surgery schedules experience unexpected delays and cancellations. So if possible, get the number to the OR front desk so that you can check in on how the day is running before you arrive. As we mentioned, being prepared is the cornerstone to success. Now, think about who you're going to be meeting with and come prepared. Purchase decisions, they require cost information and data, while surgeons require research information and data on patient outcomes. Additionally, personnel in different areas and different levels have different training needs and learning needs, and they may learn best through very different modalities, such as video or written materials or hands-on demonstrations. Another thing is to anticipate the types of questions you may get based on the groups that you're meeting with and be prepared to answer those questions. Anticipate commonly asked questions and be prepared to answer those. And also, don't just answer a question with, I don't know. Make sure you follow it up with how you'll find out the answer and get back to that person. Be ready to back up your claims with evidence from research. Importantly, don't be afraid to talk about your failures and how your company responded to them. So imagine that you're an implant vendor and your implant has various sizes and laterality options. Perhaps you found through experiences in your facilities that the product labeling was unclear to some users and led to incorrect implant opening. And while it didn't result in patient harm, it did result in waste. In this scenario, mandatory reporting is not required, and a solid internal communication process can inform improvements before harm actually does occur. Be ready to explain how your company has set up processes that encourage reporting of these near misses and how information was organized and how it was disseminated to the reps throughout your organization, as well as how you might have improved the packaging to avoid this issue in the future. Now, if your product is reusable and requires reprocessing, be ready to talk about the specifics, including cleaning, disinfection, inspection, packaging, and sterilization or high-level disinfection. This is where it is essential to engage those interdisciplinary team members in sterile processing. It could be possible that the organization does not have the equipment or processes in place that would allow for easy integration of your device into practice. Now, it's better to navigate those issues in sterile processing before any product evaluation occurs, and certainly before purchase. Think comprehensively here. Would the organization need to purchase a container for sterilization to use your device? Is your device substantially different than other devices that are already processing in the organization? And if so, they might need extensive education and training well before the time that your device is going to be used in surgery. Be prepared to talk about how your company is engaging in environmental responsibility. You might be surprised to learn that environmental responsibility is really close to the heart of many nurses, and they feel very comfortable supporting a product that is taking environmental responsibility seriously. AORN has a statement on this topic, a position statement on this topic as well. All right, surgical attire is a very hot topic at facilities. And conforming to the surgical attire policy and procedure at the facility you're visiting is one really easy way to quickly and visually show that you are on board the minute you step in the door. This should go without saying, but we're going to say it anyway. Don't leave a facility in scrubs that belong to that facility, and don't arrive wearing scrubs that you've taken from another facility. Now, most facilities have content in a policy or procedure outlining who may open sterile supplies. Even if the facility doesn't have that content, it's best that you don't open sterile supplies. Doing so can present a risk to both the patient in numerous ways, such as the package integrity and the risk for infection or the risk for retained surgical items. I once participated in this root cause analysis team that investigated the implantation of an item that was expired. A rep present in the room had opened the item, but he did not check the expiration date of the implant prior to opening it, and it was placed on the sterile field, and the scrub person didn't catch it either. The circulator was out of the room when the item was opened and was not told about the item until she questioned the packaging that had been left on her computer keyboard. Now, by then, the item had already been implanted and could not be exchanged. So, in summary, opening items is risky both to the patient and to your company. Additionally, patient positioning is also a topic that sometimes comes up but presents a risk to both the patient, yourself, the company, and the facility. Do not help position or move patients. It's okay to say no when you're asked to do things that could put the patient or your company or yourself at risk, and you will be respected for it in the long run. Both nurses and healthcare industry reps can advocate for patient safety and privacy, and one way to do this is to only enter the procedure room when your expertise is needed, typically once the patient is draped and the procedure has progressed to that point where your medical device will either be set up or used. Sometimes it's appropriate to enter the procedure room during setup of the instrument back table to advise that scrub person on what may be needed and how to set it up. However, once you're done advising the scrub person, it's best to leave the room until the patient is positioned and draped. This is a way to protect patient privacy. Now, patients are at the heart of everything we do, and their safety is a priority, and it takes diligence from everyone on the team to protect them. You are an important part of this team, and advocating for patient safety comes in endless forms. One way is to discuss the safety features of your device and how it can reduce patient risk and improve patient outcomes. Another way is speaking up. Now, speaking up, it can be really hard, but we encourage you to join us in speaking up when you see a potential safety issue in an OR, even if the concern is not related to your product or device. Also, speak up if you have questions. Now, door opening causes increased air contamination inside the OR. Keeping the door shut by only entering when you need to and bringing everything you need in the room at the same time is one great way to do that. Don't open the door to ask a question. Use the phone or peek through the window first. Door openings are a necessity, but striking that balance between when you need to come in and when you don't is key. And stating why you're doing something can help provide reassurance. So for instance, I used to work with a rep that had this great habit of coming into the OR during back table setup to help familiarize the scrub person with what was needed and how to use it. Now, that provided reassurance to the team that that person was available and that they were engaged. Then when the setup was done, but before the patient arrived, that rep, he would let us know that he was stepping out to give the patient privacy and that he would be back before the product was used. Now, this simple habit allowed the nurses to clearly see that that rep had the patient's and team's best interest at heart. His clear communication let us know that he understood about helping the team prepare while also managing to provide patient privacy and limit door openings to the bare minimum. Share your contact information or who to contact in case of questions. This is a small gesture, but it provides assurance that when there is a question about your product, an answer can be found. Some of the most connected reps post contact information at the location where their products are stored. And this is especially helpful for cases that are done after hours or on call. Ease of communication is key. Once a facility accepts your product for use, ask the perioperative leadership how they would like you to disseminate your contact information. Some facilities keep contact information in a central location, like at the front desk near the charge nurse, and other facilities store it in different ways. Clarifying how the facility would like your information and how to get it out to the right people ensures that the information can be found when needed. We talked about education and onboarding previously, but it is important, and I want to say it again. Education on the role and practice of perioperative personnel, that should come from the facility, compared with information on your devices and products, which should come from the manufacturer, meaning you. Additionally, it's crucial to work with perioperative leadership to ensure that product training prior to device trial is completed. You would not want people to see your device the first time during a procedure. Not only does this cause an increased risk to the patient, but personnel who will be evaluating your product and are unfamiliar with them are much less likely to give you a favorable evaluation. Be open to new ideas is one way to stay flexible in an increasingly complex and continually changing environment. A facility I worked at hosted an industry representative fair for all the people who worked with medical devices in the ears, nose, and throat service line. The OR personnel brought the medical devices that we had to an open space prior to the start of the day. The representatives brought the disposable supplies, and everybody rotated in small groups between stations to learn about the different devices. It was a great way for perioperative personnel, surgeons, residents, med students, and others to get a huge amount of information about medical devices used in ENT procedures in only 1 hour. The event was a huge success, and it showed innovation and collaboration between so many different people and industries. This version of educational speed dating, it was wildly popular and continued to be used at that facility for future training events for doctors and nurses. So thank you, and now I'm going to turn it over to Gail.
Thanks, Julie. This is Gail. Our presenters have mentioned several AORN resources throughout the webinar. So before we go to questions, we want you to know where and how to find those resources. AORN guidelines are available by subscription to Guidelines Plus online. They also come in hardcover if you prefer carrying an additional 5 pounds in your briefcase. If you become a member of AORN, you'll be able to access our Guideline Essentials, which is pretty much an abbreviated version of the guidelines and might be easier for you to find your way through. Your membership, should you join, will also give you access to all the educational material that's on our website, as well as a subscription to the AORN Journal, where you're very likely to find articles that you can connect your product's value to safe clinical practice. Everyone on the webinar will also want to read the AORN position statement on the role of the healthcare industry representative in the perioperative setting. It's free on the website. It is currently in revision, and we expect it to be final by late March, but you can take a look at it. In the meantime, you will find relevant and helpful information. This is really good for you to read because it will help you understand the basics of what perioperative nurses believe is important in their vendor relationships. AORN also has a resource that's called the Seal of Recognition. We didn't go over it today, but the seal tells nurses that AORN has reviewed a manufacturer's education materials and that they are in compliance with AORN guidelines. When you have the seal of recognition from AORN, you're going to have a higher level of trust from your nurse customers. You'll also see Rep Direct listed here too. We included that because it is the only credentialing resource that includes both AORN's OR protocol of best practices for patient and personal safety, and it also provides AdvaMed's Code of Ethics. As stated earlier in our webinar, reps want to stay current with your credentials and be able to show your customers you safely know your way around the OR, and rep credentialing is a great way to demonstrate that proof. James Sondrup is your AORN contact for everything we've discussed today. You'll find his information there. You can also just call AORN Direct and ask for James. as a former rep who's going to be able to speak your language and make valuable connections for you with the AORN nurses. It's important to keep in mind that we have the largest database of perioperative nurses in the world, and we want to see meaningful and effective relationships build and become stronger between nurses and reps. We're now going to end the webinar, but open the chat box to take your questions. So if you have a question, just type it into the chat box. Now, we do have a question from Aaron, and he's asking Dr. Kyle what the second step for evaluating and choosing products was. Dr. Kyle, would you turn back to that?
Yes. The first step was complete due diligence. Second step, perform analysis. Third step, conduct a trial. Fourth step, follow up.
Thank you, Dr. Kyle. Are there any other questions? You have 3 exceptionally experienced nurse decision makers from the operating room at your fingertips. We also have James, who's had your job. We have a question from Marcy, who is asking, what's the best way to make a first-time appointment? And James, I'm going to turn that over to you.
And that's a great question. From my past experience, I think having the knowledge of what the account or facility is currently using and how your product might set yourself apart to kind of make that first impression and spark some interest to get your foot in the door to make that first appointment and kind of get that dialogue going. From the nurse's standpoint, it'd be interesting to hear their feedback on what catches their attention. But I think really coming to the table with what value would you bring to have them accept that meeting.
Thanks, James. We have a question. If you know you have a product, that needs to scroll back down, please. If you know you have a product that does meet AORN guidelines, how do you get the OR manager or director to engage? And I'm going to turn that over to any one of our nurses who have been OR directors. We've laid some groundwork for being prepared with policies and procedures, but I'm anticipating that this might be your first call. Would that be true?
Gail, this is Erin. I would be happy to take that one. As a former director who made lots of these decisions and interacted with many reps, I will tell you that timing that meeting to discuss is extremely important. So if you know that director and you are able to interact with them via email or phone calls, then just ask them, when can I get 15 minutes of your time to talk about how my product will help you to stay in line with the AORN guidelines. If you're not able to, or you don't know the person, or you're not able to get in touch with them via email or phone, then I would definitely recommend being very prepared with written documentation by clearly outlining what piece of the AORN guideline you're matching your product to, and tell the story about how that product can assist them with meeting the guidelines. If you have a story about experience from another client or another hospital customer, then those stories really go a long way. So definitely include that.
And keep in mind, too, that not all of your customer contacts are familiar with all of the guidelines. It depends on their area of expertise and perhaps their facility specialty. So a tip would be to bring the guideline in hand with you and just connect it in front of them in your meeting. I'm going to go to another question that reads from Mark. For disinfectants, how do OR nurses interact with infection control and EVS when making their evaluations? Who wants to take that?
So this is Lisa. We have just updated our guideline on environmental cleaning that talks about how to choose disinfectants. And we do recommend that an interdisciplinary team is formed that does include infection preventionists, EVS personnel, nurses, and others to come together and discuss the available products, because it is their choice at the facility to determine what disinfectants they are going to use and how they need to use them. But we definitely recommend that it be a team decision and the teams have a discussion around those disinfectants.
Our next question is from Nick, and Nick is asking, what do you do if supply chain says no, even though the product is highly liked by nurses and staff? That's a tough one. Has anybody encountered that in this group?
That is a great question, Nick, and it's certainly an uphill battle that sales reps have to face, because you can get buy-in from the nurses and from the doctors, but you need to get buy-in from the supply chain as well. So some past successes I have is just trying to get everybody in the same room, and certainly if you have a champion on that nursing side to go to bat for you. If that relationship builds and you're comfortable enough to try to get everyone in the same room on why they like that product. They're obviously on the front lines. They've got their reasoning to where supply chain might not know why they like that particular product, and just try to get everyone talking and have those open lines of communication.
I'm going to take the next question for Lisa. And Lisa, I'm going to paraphrase this a little bit. Understanding that some of you reps are working from the field and some of you are working remotely, Lisa's asking, how are remote sales reps regarded by staff, and how can you possibly build trust in a remote relationship? James, have you ever worked in a remote sales role? I have some past sales tips that...
I haven't. I've always kind of been in that territory, so that'd be a tough one for me to answer, and I'm not sure if any of the nurses possibly dealt with remote reps and kind of how those relationships work.
I'd say it's challenging. I would recommend, with a past sales position that those personal touches are important, even if it's not face-to-face, but build up some confidence and trust by being in contact on a very regular basis, making commitments for when you're going to follow up and actually following up and being consistent in your relationship. That's going to grow your relationship and your trust over time, but you do start out a little bit more difficultly. I would even recommend, if you're sending emails, put your picture on your signature so that they know who it is that they're talking to. If you're sending any other little memorabilia to the nurse decision maker, include your picture, maybe a personal story, something that can connect to that nurse and what product they're selling. Does anybody have anything to add? Okay, next question. From Mark, disinfectants were asked about earlier, but also cleaning tools such as wipes, mops, etc. Should one start with AORNs or a different department?
Well, again, I think it's that interdisciplinary team. I think they're going to be the ones to make those choices. When we were looking, I've had experience with looking at cleaning supplies at my facility, and we did definitely do it as a team. We had the products, we trialed them together, and so I think just getting them into the facilities for the team to evaluate is the best bet. From Corey, we're asked, how do you get OR directors or leadership to implement a change that may not be well received by perioperative staff? That's the challenge of every perioperative leader, and I'm going to see who wants to answer that. Well, I think implement change, it should be based on the evidence. It should be based on the evidence surrounding why the change should be made, and it needs to be clearly a clear case of why and explaining why. And that's where the AORN guidelines are great to come in, because we have the evidence in the guidelines, we have the rationale on why something should be implemented, and I would start there using that as your evidence to implement change. It doesn't matter if, there's always, change is a process, so there's always some resistance at first. But having the evidence is a very powerful tool to explain why the change is necessary.
And while this question is a little vague, I would also suggest thinking in terms of being a partner with the OR director or the leadership to collaborate with them in how to implement changes. They know their teams best. You know your product best, so working with them, you can probably plan a strong implementation strategy.
I just wanted to add to the question that we had earlier about who to approach first with cleaning and disinfecting supplies for the OR, like mops and disinfectants. Many organizations will have different products that are used in the operating room versus in the rest of the hospital, and some organizations actually have a separate set of staff that will clean in the operating room as opposed to the rest of the facility, and sometimes it's not separate. So it would be nice to know the answer to that question before we determine who to approach first. So if it's a standardized form, everyone across the organization and the hospital is using the same supplies, then start with EVS. But if the operating room is using something specific to the operating room, start instead.
Thanks, Erin. That was great. This is Julie. Corey, to tag on to what Lisa and Gail said about your question about change, I would also add that knowing why the staff is resistant to the change is sometimes half the battle, and addressing it also from that angle can help people start to work through the change process and get them to a point where change is more possible. And also, I've seen fairly successfully small tests of change make a bigger impact. So, for instance, if the facility is really large, you could start in only one service line that would have, for instance, really positive impacts for that change. If you can get buy-in in one service line, a lot of times that changes an easier tipping point for others. Or if it's a smaller facility, you can maybe start in one surgeon, one specific OR, one team, and have the tipping point start there.
Thank you.
And to tag
there's
on
a
to
question
what Julie
here.
just said, if you just to tag on to what Julie just said, because this is a really important question, and buy-in from the staff is probably your biggest tool for success. Those of you who are on the call who are experienced probably know that. If you are able to get one person in that operating room or in that department excited about your product and have them start to tell stories about how it benefited them, that excitement will build. So start small, just like Julie said, and you know how word travels in the operating room. Use that to your advantage.
Our next question is, are decision makers open to cold outreach on LinkedIn?
That's a really fascinating question, and I would agree with Erin. I think it's dependent on the person. So you may find that's yes, and you may find that's no. But to respond to this, to link that to this next question about is no response to email a confirmation of no interest, if you don't get a response on LinkedIn or on email or voicemail, I would say that my first gut reaction would just say, no, that's not necessarily an indication of no interest. It's sometimes an indication of no time. And keep in mind that perioperative leadership is one of the busiest jobs I've ever had, and I would say that it's not usually a lack of interest because a lot of products hold great benefit for patients. It's usually a lack of time to be able to dedicate to looking at those things, and sometimes capturing that face-to-face is helpful in that way, but not certainly the only way.
Another strategy to deal with the no response issue is to find out if that perioperative leader has an assistant or there's a department secretary, or maybe there's a business manager that works in that department, and try reaching out to someone who can help you get in touch with that actual decision maker. Oftentimes, if you can get a hold of their assistant or secretary, that really is helpful.
I would agree with that. This is Lisa. And also, I was a clinical nurse specialist in my facilities, and I did a lot with products. And so there might be someone else that you may not be thinking about that would be, have a decision-making on products that's not the manager or the leader, because the clinical nurse specialists are a great resource, and Julie was also a clinical nurse specialist, but I did a lot with products and evaluating products and had lots of influence over them. So you might look outside the box, too, for other people in that facility that might be a good resource.
Asking to know who makes the product decisions is half the battle. One facility I worked at, an anesthesiologist ran the value analysis committee, and you wouldn't have expected that given all the products we looked at. So there's a lot of different opportunities to find out who is making those decisions and when the best time to meet with them or contact them is.
We're pushing close to an hour. I think we're able to take just one more question, and that's from Terry. And Terry's asking, how do you work with supply chain, choosing only products on cost versus what may be best for the patient or even what the staff wants? I believe we've answered that. Go ahead, Erin.
Well, just to add on to that, so if you're finding yourself in a situation where you're hitting a wall and not able to get past materials management, organizations have to work very closely together, and they're under some very strict rules and constrictions on what they can purchase based in contracting issues, and that gets very complicated. But if you can get information about how your product has, for others, enhanced patient care, has improved patient safety, and has improved return on investment for any other organization, if you can get those stories to the ears of the clinicians, that will be probably your best strategy. So get those stories there, and if you have clinicians that you've dealt with in the past that are really pleased with your product, maybe ask them, hey, would you be willing to talk with this other facility and tell them about your experience, and get the clinicians talking to one another.
Thank you, everyone. Thank you, all of you who tuned in today for the webinar. Some questions were around access to the webinar, and yes, it was recorded. You'll be able to find it in the next few days on the AORN website. If you just click on the industry tab, you'll find it there. We do plan on doing future webinars, and we want to improve the quality of the information that we're giving you. So we're going to be sending out a survey to all of you who attended. And I hope you'll fill it out and return it to us and help us help you make better connections in the OR. Thank you very much from all of us at AORN for being with us today.